So when a patient comes at Lifetime Dental, we go ahead and take a 3D scan and evaluate how the bone condition of the teeth is. And based on that, on the x-rays and all the data that we gather, we decide whether the patient is a candidate for full arch or whether we can go ahead and save a few teeth and maybe go ahead and do a combination of crowns, bridges, implants. But if most of your teeth are failing, they are broken down, they're not in good shape, uh, then definitely you're a candidate for getting a full arch of implants, which also is called as an all-on-X. And there could be multiple ways that we can go ahead and do this, whether it can be a fixed option where we get a fixed final, or it can be like a snap-on denture where we're replacing all your teeth but having the denture that snaps onto the implants. So based on how the bone structure is, what are your requirements, we go ahead and qualify and do the analysis whether you are a candidate for doing a full arch or not. So we do get a lot of patients who come in that say, Doc, I've been to another doctor and they say that I don't have any bone over here, so I'm not a candidate for an implant. I can never get an implant ever. So I have to live with having either a partial or just a regular denture and suffer through it. But that's actually not true. We here at Lifetime Dental, our specialty has trained us to go ahead and do bone grafting procedures, be it to increase the width of the bone or maybe do some sinus grafting procedures. That way we'll be able to go ahead and help you out by placing an implant ultimately, so that we can go ahead and make sure that you get the treatment that you want and not compromise on that just because we don't have the skill set to do it, or just hide behind the reason that you don't have bones, so you don't get an implant. Here at Lifetime Dental, we customize all our treatment plans tailored to the needs for the patient and what the patient wants and what the patient can get based on the analysis that we do from the scans that we do, the 3D scans, the oral exams and everything. So every patient treatment plan is different. Not all patients get the same treatment. One patient might be a candidate for getting a full mouth of implants. The other patient might be a candidate just to get a single implant. So a dental implant per se is not just one treatment, it is a combination and a customizable treatment for the patient based on the needs for what the patient wants.